Hello viewers, today I am going to demonstrate you a technique in which you can reduce dislocated shoulder if it's an anterior dislocation without any anesthesia, without any sedation, without any medication within few minutes. This technique was described by L. Prakash, and I wish I had known about this technique in my early years. That would have saved a lot of hassles in my clinical practice. Now this technique is pretty simple. You ask the patient to sit. Usually anterior dislocation patient will have attitude in which the arm is slightly abducted and externally rotated, unlike posterior dislocation in which hand is internally rotated. So if the shoulder is flat, hand is in this position, what it describes is initially to keep the hand abducted and externally rotated in this particular position for a minute, and then adduct and then internally rotate, and most of the times you will be able to reduce it. So let's see, and we'll try this on this patient. So today the technique that I'm going to demonstrate is a technique which was described by L. Prakash, and this is a very beautiful technique in which you can reduce the shoulder without giving any form of medicine. So you don't need even sedation. So if you see this gentleman's right shoulder, it's completely round. The left shoulder is flat, and he had an episode of fit in which he has dislocated his shoulder. We have done the X-ray, and there is no associated fracture, hence we decided to do this. So the first important thing is to take patient in confidence and then slowly start externally rotating it. So slowly start externally rotating it, and just do it gradually. Just do it gradually so that patient doesn't feel too much discomfort. And it works every time, almost every time this will work. So now if in this position, hold it for at least a minute. So we'll hold it in this minute, and a lot of time it will reduce in this particular position. So keep it in this position for roughly a minute. बस बेटा. And then in this particular occasion this has already reduced, but if it doesn't reduce, then the second maneuver is to do adduction and then internal rotation. But as I said, a lot of times this will reduce, and you can see that the contour is now beautiful and the shoulder is reduced, the pain is better. That's better ho gaya? So patient will complain, patient will report immediate benefit in the pain. So this is a beautiful procedure, and I must congratulate Dr. L. Prakash for devising it, because I have tried so many times and it works really well. And beauty of it is you don't need any sedation, you don't need any anesthesia, and it will work out almost 100%. You just have to be patient, and you just have to take patient in confidence. So thank you. So viewers, you saw that how easy is it to reduce dislocated shoulder, and if you follow the steps, I'm sure almost 90-95% of the times you should be able to reduce it without any issues. I hope this will help you in your career and in your clinical practice. If you like this video, please give us a thumbs up, please do subscribe, and do share our channel. Thank you.